Yeah, so we were fortunate enough to launch a new program here at the Tacoma campus for MultiCare with video urodynamics. And this is the first place in the South Sound that has this capability. And what video urodynamics does is it's a combination of measuring pressures in the patient's bladder and body and visually observing what's happening with the urine as it passes through the urinary tract with X-ray technology. That allows us to really focus in on the complex avoiding dysfunction patients that are struggling and not having a good diagnosis and aren't really sure what their issue is that's creating the symptoms that they're suffering from. For urodynamics, patients that we're really looking for that need that video component are those that can have difficulty urinating and they're not sure why. They feel like there's some sort of obstruction. It also is very beneficial in people that feel they have overactive bladder and their bladder is peeing or making them pee too much and they feel like they have a strong urge and it's not really clear as to what the etiology might be. Additionally, we look at this technology to help us really solidify what is happening on patients who have urinary incontinence, and we can see the exact location where, hey, this is the part that's not working, this is what we need to really address and fix. And the last component is that patient that does have a neurogenic bladder or a bladder that doesn't contract. And those patients, they know they're either using catheters or have some type of urinary diversion that they're using to manage their urinary system, and it helps really make sure that they're in a safe spot, make sure that there's not something that's happening to their bladder. So the benefit of having urodynamics for our patients is that with that information in hand, often we can give them a very detailed plan of what we should do to intervene together to make their urinary symptoms better. And that can range from, self-help, physical therapy, medication management, and surgical interventions. So when a patient gets signed up for urodynamics from one of our referring providers, they can anticipate approximately a 30 to 40 minute procedure time. It will involve a catheter getting placed into the bladder, a catheter getting placed into the rectum. And people go, why are the urologists putting a catheter in my rectum? But the reality is we need to know exactly what pressures are getting exerted on the bladder. So the rectal catheter gives us a surrogate for your abdominal pressure. So we know if your belly muscles are squeezing or not, and we can subtract that out from what the bladder catheter is reading. That tells us what the bladder pressure is itself. And then there will be the use of X-ray technology, so we will be taking imaging during the study. The study then will fill up your bladder with IV contrast or IV fluid, and that allows us to visualize the bladder. We'll be able to assess if there is any abnormalities in the pressure within your bladder with the contraction of your bladder, and then we'll have you attempt to void if you can, and that will show us the outlet or the urethra, the tube that drains your bladder, and will show us if there's any evidence of any obstruction. So the first thing you need to do if you're interested in getting a urodynamic study is really get a consult with myself or one of my colleagues. We will help you determine if that is the right test for you or not. We don't want to use it indiscriminately because there are some risks in this procedure. There's a small risk of getting urinary tract infection by placing catheters into the bladder, and there's a small radiation exposure risk, so we do use it judiciously, but overall it's a very safe procedure. And with a consult to one of our urologists here at MultiCare, we'll be able to determine if that is the best study for you to get us the answers we need to get. I'm really excited to be able to offer urodynamics here at MultiCare. This is one of the parts of my practice that I've had, and I didn't, I felt a little bit naked not having that extra ability to look at patients and really give them a good diagnosis. And now that we've been able to, get the program started here, it lets us kind of complete the complex patient with avoiding dysfunction evaluation, in my opinion, and really gives us a better diagnosis and better outcomes for our patients.